What's up, friends? It's Haley, aka Bird, and you are tuning in to the Give 'em the Bird podcast. This podcast is all about challenging what it means to be healthy and fit. It's about celebrating sustainable behavior change and non-scale victories. And most importantly, it's about giving the bird to the diet industry and societal expectations of body size. Why? Well, because at the end of the day, you have an entire life to live that does not require your body look a certain way. Thanks for tuning in. Now let's give 'em the bird. Hello, everyone, and welcome back to another episode of GTB. I'm Haley, aka Bird, and as always, it is a pleasure to have you here. I hope that you have made it through the first month of 2022 smoothly, with ease, and that you are continuing to take care of yourself and nourish and cultivate a healthy relationship with your mind, body, movement, and food, and taking care of yourself. I am extremely pumped. I know you can't tell, but I'm extremely pumped to share today's episode with you. I had the honor of chatting with Dr. Mary Hausler, who is a certified pelvic floor physical therapist at the University of Iowa Hospitals and Clinics. A little bit more about Mary. She graduated from the University of Iowa Doctorate of Physical Therapy program and immediately entered into the pelvic health world, serving all genders. She's super passionate about eliminating shame and upholding the dignity of her patients currently living with pelvic floor issues, including things like incontinence, pelvic pain, bowel issues, pain with sex, postpartum recovery, and many more. Mary is adamant about creating a safe space in her clinic for all bodies and is additionally fighting the quote-unquote lose weight response most experienced in medicine and specifically the physical therapy realm. Do you love her or do you love her? If you don't already, I guarantee you will by the end of this episode. Mary knows her shit, which is great. But what's even better is the way that she educates and shares it with people. She discusses taboo topics like bodily functions and sex with levity and with humor. And it's not because she takes these issues lightly, but because she is extremely devoted to women's health and empowerment, in addition to many other things. When I originally scheduled this interview, I thought we would be talking about things like core strengthening and postpartum recovery. And while we do get into those topics a little bit, the majority of our conversation is around vaginas, or as Mary calls it, queen. A little bit more about what we cover. Mary tells us how she got into pelvic floor health, like what it was that inspired her to get into this work. And then she dives into what even is the pelvic floor, what is its role, what is its function. And I will give you a hint. It is a massively important group of muscles in our body. I knew it was important before we talked, but now I just want to embrace it in a warm hug and tell it thank you for all the things that I now know that it is in charge of or that it helps control. Mary and I talk about the connection between the pelvic floor and mental health, which I found this super freaking fascinating. And I think that you might too. And then Mary also gives us tips on how to take care of our own pelvic floors. And this was not at all what I was expecting. Again, when I think about taking care of my pelvic floor before this interview, I thought core strengthening and Kegel exercises and stopping my stream of urine when I'm peeing, all these things. Mary dives into all of it and really opened my eyes to what really impacts our pelvic floor health, which is super exciting. She gives us an overview of what a pelvic floor exam with her looks like, what are some common causes of linking, how we know if our pelvic floor is relaxed. We cover a lot of common misconceptions with pelvic floor, and so freaking much more. Towards the end of the episode, we also dive into the connection between physical therapy and GTB, where we intersect and where we overlap. And Mary tells us about her experience in PT school and in healthcare as a plus-size physical therapist, and really how it has informed the way that she practices. We then wrap up the episode ranting about weight bias and how we hate it, and I urge Mary to get a TikTok, which you will hear. She is basically on the very edge of getting it, and hopefully by the time this episode airs, she will already have it, and I will post it in the show notes. So more to come on that. You'll see it in the show notes if it makes its way in. Overall, this conversation with Mary was so educating and empowering and freaking fun. This was probably the most fun I've ever had interviewing someone on GTB or just in life in general. We actually ended up talking for nearly an hour and a half, like another half hour after the podcast was recorded. So she is a cool person. I do want to give a quick content warning that there is mention of sexual assault around minute 31 of the podcast when we're discussing pelvic floor exams. So please feel free to skip straight to minute 32. You can pause the podcast and return to it when you feel more comfortable, or you can choose to skip this episode altogether. All right, now let's get into it. Enjoy my conversation with Dr. Mary Hausler. Hello, everyone, and welcome back to another episode of Give 'em the Bird. My name is Haley, aka Bird, and on today's episode, I am chatting with my new BFF, Dr. Mary Hausler. Hey, Mary.
Hi. Oh my gosh, bestie.
I'm so excited for this. Before we talk all things pelvic floor, because that's
Yes.
really going to be what we really dive into tonight, tell listeners all about you. Who are you?
Well, I am a certified pelvic floor physical therapist. I did my undergrad degree in all things science, biomedical, had no idea where it wanted to take me other than just medical field in general. And then I really liked physical therapy. And I told my parents this because everyone keeps their clothes on and you never have to deal with needles. And now I am a pelvic floor physical therapist who does dry needling. So I don't know what happened in between there, but I went to the University of Iowa for Doctorate of Physical Therapy. And since I walked in the door, there was a presentation about different areas of pelvic floor or PT in general. And one person gave a pelvic floor PT presentation. And I was like, I want to be you when I grow up. Absolutely. That exact week one, I knew it. So then every time it was brought up in class, like the whole class is just like 40 of us students are turning around going, all right, vagina lady, this is where you shine. I'm like in the back with my hands up. So I knew so early in PT. So then I set myself up by getting internships and clinicals in those areas. I'm born and raised Iowa City. I love this place. I think it's the best place in the whole wide world. And so I still live here. This has been my dream job since forever. I grew up looking at that hospital like I'm gonna be there. That's gonna be my home. So I am passionate about what I do, and I'm so excited to be on this podcast. So excited.
So exciting. Wait, I'm very intrigued by the fact that, like, what was it that drew you to pelvic floor? If you can remember back to that first like presentation or whatever, what was it that was like I love vaginas, I really want to do this work? What was it?
So a few things, right? So everyone that goes into PT usually starts out as I busted my knee in high school, or I hurt my hip. And so I loved physical therapy. That's what I wanted to do. Well, once they announced it, I was like, oh my gosh, my whole family does the PP dance. And I love talking about things people don't want to talk about. I love getting in the nitty gritty. So my day being poop, pee, sex is just like the dream apparently for me.
Love it.
But also I just grew up in such a women for women household. My mom is one of 8 kids. I have so many aunts that are just these don't mess with them ladies.
Yes.
And so from a very young age, it was put in me that like, we need to fight harder for our women. And I was like, make this, I don't have to deal with men a lot of days. I'm growing to love male pelvic floor things, but my first job immediately out of PT school was literally women, and I loved it. It was my dream.
I love that. That is so cool. And just that you come from like a long line of badass women. I love that.
Do we all kind of pee dance it up when we're like scrubbing the dishes after our Thanksgiving meals? Absolutely. And now I go to family reunions, I'm like, who's peeing their pants? Talk to me after dinner.
Oh my gosh. Oh, you are so good. I love your humor. That's so cool. So I didn't even know about pelvic floor, even though like I studied health promotion at the university, but I mean, we don't get into the nitty gritty of like, that stuff. But my sister, who I'd mentioned before we started recording, she got very interested in it when she had her first baby. And so she was kind of like, here are some things to do ish. But I remember my first introduction to pelvic floor, and I didn't even know that it was the pelvic floor, was an episode of the Keeping Up with Kardashians where they talk about Kegels.
Yes.
Yeah,
Yes.
I was thinking about that. Like, where did I first learn about Kegels? And I was like, oh, it was Keeping Up with the Kardashians. And they also said that to like strengthen, I think they probably use the term like strengthen your vagina because it's the Kardashians.
Yes.
They said you should like stop peeing and like hold it, but I've since learned that maybe isn't the best thing to do. Yeah, so
No,
this is why it's really good we're talking.
I do think Kegels are owned by the Kardashians. It starts with a K. It just kind of like fits
It
with
makes
their
sense.
aesthetic. But I don't mind if people do that as like a test. But if you're constantly doing it, you retrain your bladder and can lead to urinary retention. So I tell people
Oh,
like,
wow.
you can like go for it, try it. Absolutely. Do you feel, because a lot of people then find out they have no control. But our bladder is the most habit forming organ in the body. So like when I was a kid, I would wash my hands, go to the bathroom, time for dinner. As an adult, I'd sit in restaurants, my food would come out and I'd be like, I have to pee because before
What?
dinner, I have to pee, right? There's all these little things. There's a lock and key trigger. You get home from your job, you put the lock in the door, I have to pee, right? Or I'm leaving for a road trip, I have to pee. There's all these triggers.
Wow.
And so if we start to train our bladder, stop peeing while we're peeing, girl, we're going to lead to issues, you
Oh,
know?
it's gonna store some piss.
Common misconception. Absolutely.
Wow. I'm so glad that you shared that with me. I saw like an Instagram a Instagram live a while back, somebody that I used to follow. They had a baby. Or not a physical therapist, personal trainer, had a baby, and then they got really into like pelvic floor health, and that's where I learned you're not supposed to cut off the stream. Like it's not necessarily the best pelvic floor advice out there. So,
Yeah, so
yeah,
true.
this is good.
And that's how most people get into this field. Truly, they are PTs that have a kid and they realize, oh my gosh, there's a
This is
whole,
important.
like, we don't learn a lot of this in PT school. We had one lecture, I think,
Oh, wow.
and that's my entire job is just one lecture. I mean, I do more than that, but really
Right.
one lecture has expanded into an entire career.
So, do you have kids?
No, no.
Okay.
Sorry, that was so abrupt. No, I
Oh,
do
no.
not.
You can say that to me because I'm even though I'm engaged, we're like still on the fence about having kids. So like I'm
Yeah.
absolutely pro-choice when it comes to children in all forms.
I think three, so there's 4 pelvic floor physical therapists on our team. 3 don't have children,
Oh, wow.
all for different reasons. But I do feel like root of it is we know too much.
Yeah, I know what's gonna happen when I push out a baby out my vagina.
Well, and it's, to be fair, no one's coming to me if they're having a good time. And so like if you're having terrible pain in pregnancy or your postpartum recovery is really hard, those are the folks that tend to come to us. And so yeah, I just sit and reflect on how that I don't want that for me at this time.
Yeah, that makes sense. That's a beautiful way to say it. At this
Thank
time, or
you.
maybe ever. Um,
Right?
yeah. Before we continue talking about the pelvic floor, I want you
Mhm.
to explain what it is and what its function is for folks that may
Yeah.
not know.
I think I'm nervous. I'm going to go into my teacher voice because I give the same routine all the time.
That's okay. I love
But
teachers.
the pelvic floor is a bowl of muscle inside of the pelvis. And if you've never looked at it, I encourage Googling because usually I use the 3D model so people can see it in space. Every single person has it, male, women, female, all genders have a pelvic floor. It's just muscles. And there's 4 main function. I usually tell people we have 3 holes. They each get their own doctor. I get to do all 3. So I
Oh, lucky
do,
you.
right. Thank you. I do bowel, bladder, and sexual function things, as well as it's a very posture stability muscle. So for those personal trainers, we work a lot with pelvic floor on performance, right? Because you can have strength that gets you by in your day. You can have strength that can control bowel, bladder, sexual function. There's also this next tier, right? There's performance, and there's some newer stuff coming out that should get more research about how if we're better at training the pelvic floor, you can deadlift more, right? You can run faster miles. Like if
Oh, wow.
you get that on board and have a better core stability, um, you can perform even better. But most of my day is spent with bowel dysfunctions, whether that's constipation, or hemorrhoids really are kind of the biggest ones. Bladder stuff, whether that's incontinence, some incomplete emptying, hesitancy, frequency. I have people that come in, they're peeing every 15 minutes.
Oh, geez.
And then sexual function, that is my favorite thing to treat. Pain with sex is my absolute favorite, because 75% of women go through a period in their life in which sex is painful, which is cuckoo bananas. It's just such a huge number. When you look around, 3/4 of women have had a period in their life in which sex is painful, and it's so alienating. It is so lonely. And the one person you want to talk to about it is your partner, and they're the ones causing it. And so it can feel just hopeless. And so to me, it's such a quality of life thing. I can treat your back pain, I can treat your shoulder pain, I can treat knee pain, but if you can't sleep with your partner, like, that is game changer. And I grew up, my dad is a youth pastor. I grew up in the church. And so additionally, I deal with a lot of religious trauma. I still identify as a Christian, but I deal with a lot of folks that grew up in very religious households too. So we get a lot of people that can't insert a tampon, can't insert a penis at all. So it is, and when they finally can have sex, it's weird the things I celebrate with my patients. We're like,
I think this is
penis all the way.
Yeah.
And then we like give ourselves a round of applauses. So
that is so cool. I didn't even see, that's like in my head, like I wasn't even thinking about that when I think about pelvic floor. Like I literally just think about peeing
and like, sometimes pooping.
Yeah.
But most people just think of incontinence, and if my day was all incontinence, it wouldn't be bad, but it just gets repetitive. So really there's a lot more to it. And the other thing is just pain, painful periods, endometriosis, PCOS. I deal with so many people where they have pain from rib cage to knees, anywhere in between there I work with. So and those ones are some of the most complex, is just pain patients.
And so all of those like different chronic conditions or whatever, they all have to do with the pelvic floor.
Yeah. I truthfully think almost every single person has some sort of pelvic floor issue. Wow. Again, maybe like a bias who I'm exposed to. But I think as women specifically, we learn to just live with inconveniences. And from a young age, we're told like periods are painful. Cool. So like, just welcome to being a woman. Thank you for joining us. And I get to work with so many women that I'm like, oh, here's, yes, you can take ibuprofen, but here's ways you can stretch those muscles at home. Here's some ways you can do better about breathing into those muscles, expanding them out. I love TENS units, or trans, electric, what is it, neurostimulator, whatever, TENS units, electrical stimulation, which can block pain. I use one every single month.
Wow.
It's not just sometimes with those chronic conditions, it's not learning how to be pain-free, because we know that's not necessarily the case. It's how can we better manage, and how can we better participate in our days.
Okay, that what you just mentioned about the period pain, I came off of birth control, I forget, at like the beginning of the year. I'm not trying to have a baby, just like for other reasons. Weird, gotta clear that up. I'm not trying
for all the listeners, we're not having babies.
It's no little birdies are being born anytime soon. I'm not hatching.
I was trying to say, not hatching any.
But I didn't realize for how long, like I never had any sort of cramping, because I was on the pill since I was like 15. And now I'm, 28. And now it's like the first 2 days are fucking awful. Like it's so bad. And that's what I'm told. Just like, some Midol, some ibuprofen. And you're telling me there's other things that can be done.
Right. It's not just slap a heating pad. And then mine are like really terrible. And what was hard too, is I went to my physician recently, and she said, how are your periods? I said, super painful. This is how I manage them though. And I'm okay. And I can wear my TENS unit throughout the day. And she said something like, well, really hormone therapy or birth control is the only way to help that. And I was like, I came to you for a holistic approach and I'm telling you how I treat mine. And she was like, well, and then we kind of moved on. And then later she's like, so are you interested in that birth control? And I was like, no, like it is your muscles reacting. Your ovaries actually sit pretty close to your hip flexors. That's why people get pain in their back, is because they irritate and compress your spine, which also then shoot down into your hips. So people get hip pain.
Wow.
Like it all is so we tend to compartmentalize the body. And I am like, no, you are one human. I have to look here to here because they all work so closely together. Yeah. The uterus doesn't just live in its own world.
Wow.
Which sometimes it feels like it does.
I feel like I'm going to have you on like 12 more episodes because seriously,
all down.
This is so good. And I also, another side note, I just had a similar situation like that with a dermatologist. I went in for a dermatology checkup. I hadn't been there in a while, and I went in and she was like, any changes to medications? And I was like, oh yeah, they really upped my anxiety medication and I got off birth control. And literally by the end of it, she was like, well, at first she goes, oh, you're trying to have kids? And I was like, no, like you can get off birth control for other reasons.
Right.
And then by the end of it, she asked me again, like, so would you consider getting back on birth control for your acne? And I was like, bitch, did you not hear me? Like, I'm pretty sure I just said I got off of it. Like,
right. Yeah, and I have a derm appointment next year and I am going for acne as well. That's very like cyclical. Yes. And I can hear it now.
Oh yeah, it'll get brought up. Yeah, I know. I'm diving more into like, yeah, that's a whole nother topic like of interest to me.
The next episode.
Yeah, join us, part 2. Yeah. Okay, that is so good. So pelvic floor, it is involved in. Everybody has one. It's very important. It's involved in a lot of different things beyond just incontinence. And so. I guess maybe it's along the same lines when I ask like what its function is, but would you say that's like it helps us to stop peeing and stop like
yeah, I tell people
are all the things?
Yeah, I tell people it contracts to hold pee poop insides in, right? And then it relaxes to let pee poop, penis, and other things in. So it has two, but the hard part is it has two very opposite roles, right? Contract aggressively so nothing falls out of our body, and then relax so to complete this full release. But that's so wide on a spectrum in the smallest space possible with muscles you didn't know existed. And so I've had patients where just the education alone, I don't give them much homework, but to connect with your body and actually know what's going on helps symptoms immensely. Right. And it's also like more mental health wise, like you brought up anxiety. There's some really cool studies that there's one where they hooked people up to electrodes and had them watch a scary movie, which sounds like my nightmare. But they found the muscles in your pelvic floor are one of the first and strongest reactions to fear and anxiety. And so if you come in with a shoulder pain, I'm not like, how's your mental health, sweet pea? But if you come in with pelvic floor overactivity, like you're clenching all the time, I talk about anxiety. I talk about postpartum depression because this is where we tend to hold it. And I tell people, like everyone talks about, I hold stress in my shoulders. I'm like, get in line, Jessica. We all do. Okay. Yeah. But that shoulder tension, I think of as kind of like that day to day, right? I can't find a parking spot. I'm running late. My kids being annoying, right? All of those things. That's this. That pelvic floor is just that truly that anxiety of why am I stressed out? And so everyone this year has been coming in being like, I don't know why it's worse. This past year's got, and I'm like, take a look around.
Turn on the news. Yeah.
I'm like, pick a headline. The world is on fire. Your body knows that. And it's holding it in just the deepest, darkest places of yourself. Wow. And I have myself, and I know a bunch of my coworkers have trauma-informed care, because sometimes when we release those muscles and release that, it has nowhere to go but come out. And it can be a very triggering activity. But it also is amazing to partner this mental health therapies and pelvic floor because they're just so interconnected. So I think another role of the pelvis is just like holding, which is good, except for when you're holding too much, right? So function is contract, relax, and push out a little bit. But I tell people straining is for pasta. Don't push while you poop. Any amount of pushing is too much pushing. Get a squatty potty. That's everything.
Straining is for pasta.
Yeah, I'm full of one-liners. Come on now.
I just can't wait. I'm just gonna like injure myself, so I have to come see you. Like, this is so exciting. I just want to hang out with you all the time. Yeah.
We can just clear up little things. I don't get a lot of people where they're just like, sometimes I do this. Everyone that comes to me is like, I pee myself and I can't control my farts and sex has hurt since 1812. And I'm like, okay, sweet. Where do we start?
Oh my gosh, you are lighting me up inside. You are seriously amazing. You're definitely gonna have to start a TikTok. Like, absolutely. Don't even get us started.
We will circle back to this.
Yeah, we will. So good. I think that's really interesting what you mentioned about like anxiety too, because I think about like when I went through, I have a 100-hour yoga teacher training. I didn't complete the whole thing, but we talk a lot about like, you know, when you sit in like those hip openers, like half pigeon and stuff, like it can feel emotional. And even during the training, like, I don't know if maybe it's just a placebo effect, but one of the gals that did the training with me, we would be in a pigeon pose and we'd look over and we'd both be crying and we would start like, I'd be like, why are you guys?
You're doing this too?
Yeah, like it releases emotions. And I always thought like, but I think to hear that from a PT, it just hits different than like a yoga teacher, you know?
Yeah, fair.
That's amazing though.
Well, and I don't know if I don't think I mentioned this. One of the muscles in the pelvic floor, the obturator internus, there's no quiz. I'm just telling you this. Okay. The obturator internus muscle is actually a hip muscle inside the pelvic floor. So I get plenty of people that come in with hip pain as well. That this muscle specifically overworks if your glutes are weak. And and every single person under the sun could use stronger booty muscles. And so sometimes that hip pain can jump into the pelvic floor and cause issues internally because of that muscle is like a bridge. But also we've had people like opposite come in for hip pain to see someone else and they can't identify it at all. We will see them and we'll poke on that muscle internally and they're like, yep, that's it. Ouch. That's my pain. Wow. And so it kind of goes both ways. Hip stuff can really jump between. So hip openers specifically could combine that hip release and pelvic release.
That is so interesting. It's like, the body is it's so cool. And I think the mind, like the body and the mind connection too is, and that's one thing I've just been learning so much about since I've gotten into like intuitive eating and creating a healthy relationship with exercise too. But to actually know that our mind and our, like the physiology of the body is just like, fuck.
Yeah. Like, I always tell people, I'm like, if I could remove your brain from your body, first of all, I wouldn't, but I would because it like is ruining progress sometimes because we can make all of these strides. Someone gets overly stressed out and back to like not square one, but it can really knock whatever progress just because I can't separate those two. And I don't know if you've ever seen those photos that compare the like vocal cords and the epiglottis to your vulva and vaginal canal and stuff like that. Like the anatomy is like twins. They look the same, fraternal twins. And like I tell everyone from top to bottom, you are connected. So yeah,
that's wild.
It's amazing. The body.
The body is just so cool. I love
the body, man.
The body. So we know a lot about the function of the pelvic floor, what it does. It's so freaking important. How do we take care of it?
Oh my gosh, good question. I think the hardest part when I talk about like giving advice is it is so specific to people. Totally. And so my first recommendation always is get an eval. Try to find a pelvic floor therapist near you. To be fair, some do claim to do pelvic floor therapy, but don't do internal. And I think that's just a huge missing piece. So I always tell people to call ahead if you're not in my area.
When you say internal, like you go up the vagina?
Oh, yeah, I didn't explain that.
No.
Yeah, so my exams are I always tell people I'm the nicest internal exam you'll ever have, but I do think the bar is very low. So, I don't use stirrups, I don't use a speculum. All I have people in a very relaxed position, kind of butterfly, but there's something underneath your knees supporting your legs. We take big breaths first. We make sure our legs are relaxed, our butts are relaxed. And all I do is I insert one finger, and there's 3 muscles on each side that I poke on for what I call the vibe check. What's going on, right? So they're just muscles. Muscle, like you get shoulder knots in your, or muscle knots in your shoulder, you can get muscle knots in your pelvic floor. Are they sitting super tight? Are they relaxed? Is there not much muscle bulk to them? Like, do they feel weak? And then after that, I check strength, endurance, relaxation, how well you push. I check the function of everything. And then I often check for prolapse too, which is kind of like a postpartum issue as well. But yeah, I check internally on almost every single
I wondered
patient.
when you said like I told like I wanted to be a also if you hear my dogs barking, sorry about that. They're wild. I told my parents like I wanted to be a PT because people keep their clothes on. And then when you were like, and look at me now, and I was like, wait, I, I didn't
Yeah,
realize that. That's
yeah,
interesting.
no, yeah. So I do both like vaginal and rectal exams, kind of depending
Okay.
on what the symptoms are. And I think I probably should have prefaced this. There's so many people that come in and I go, what did your physician tell you about me? And they're like, nothing. And I'm like, great, thanks for
Now
coming.
take your
Oh
clothes off,
man.
honey.
Yeah. I'm like, did you know we were going to do a rectal exam? I was going to put my finger in your butt and no one knows. So it's good to know that, but also with our, what is it now? Like 3/5 of women have had sexual assault in their history, right?
Yeah, way
I
too high.
always tell people, you are the boss in my room. You are in charge the whole time. I'm not a physician. I don't have to get anything done. You set the pace. And so at every single point I ask like for consent, I'm checking in. And if at any point they're over it, we're done.
Cool.
So I always tell people there's no surprises. So I'm like, all right, we lay here, we relax. I'm going to umburrito you from the sheet real quick. And then after I insert and I'm working, I cover everything up with the sheet. I don't need to keep you open to the world. But I recently I've had quite a few of people with pretty extensive sexual assault histories. And I just hear them and give my best guess. And then I what might be helpful and then send them home with homework. And then they report back.
Oh, nice.
I don't have to do anything in clinic. And so really the patient is the one that sets the pace for internal or no internal, or do we just poke on the muscles from the outside? It's all up to them.
Right. But having that internal exam, like it can be, you don't necessarily have to do it, but you were saying before I got you way off, like
Right.
that can be a really helpful thing
Right.
for people to
And
do.
not that other physical therapists from the outside can't get a good read, but it is like I've had people that go to other pelvic floor therapists, they do nothing internally and they're like, great, you're doing awesome. And symptoms are better, but not perfect. And then they come to see me and I explain and they're like, oh, I wish I would have had this
I had known
first.
that.
So so if looking for a pelvic floor therapist, I always just say, call, make sure they do internal. Because it's such a hot button topic. People all over are claiming to do pelvic floor therapy. And when it comes to this area, I just always want people to get the best.
I even think too, there's a lot of pelvic floor or personal trainers that are like claiming to be, I say claiming, there are some that maybe have like certifications in it, like pre and postpartum and everything, but but literally on like their Instagram, it'll say like pelvic floor physical therapist. And just hearing this from you now, it's telling me that, yeah, there's a disconnect clearly,
Well, and it's not like worst case scenario, you come to me, one of my coworkers, another pelvic floor therapist, and you have one eval and they're like, oh no, what that PT or that personal trainer or that other person is saying to you is correct.
It's good. Yeah.
Great. But leaking, like specifically incontinence, can be for 2 different reasons, which we talked about earlier talking about more misconceptions about pelvic floor therapy, you can leak because your muscles are weak, right? Maybe you have a baby, maybe they're just weak for whatever reason. You go to cough, sneeze, lift, whatever, muscles are like, meh, thank you. I don't have enough strength for this, right? And then you leak. But you can also be the one where your muscles are overactive, right? Maybe baby comes through and your muscles go, what the hell was that? Right? Or you're a tense person with anxiety. Like there's so many reasons. These muscles, maybe you have low back pain, your muscles are guarding, and your muscles just don't have enough left in the bank. So I think of it kind of like a punch. Like if your arm is almost all the way extended, you can only give this much more, right? Whereas if you relax that muscle, you could wind up and give your full punch. Same thing in the pelvic floor. And so when people are like, well, if you pee, just Kegel till you die and you'll be fine. Absolutely not. And in fact, a lot of women I know don't know how to relax. So that has been kind of my focus. And so it's not just Kegels, it's not just internal work. Sometimes it's how do we relax those muscles, turn off those muscles. And I've never told a woman relax and had that go well. Right. So instead, I give tips, tricks, ways to get them to relax that aren't just like chill out. Right? That's not helpful for anyone.
Yeah. Yeah. How do you even know if you're like, as I'm sitting here, you probably saw me like get a little distracted because I'm like, am I relaxed? Like, how do you know if it is relaxed or not?
I know that's the hardest part.
Is there a way to know?
There are ways. They're kind of hard. I always try to get people to do big belly breaths. So if you expand into your belly with your breath, right, your pelvic floor drops down and out as well. And so sometimes I tell people in a chair where you can like feel your vulva on the chair, you take a big breath in. Does that pressure increase? Right? Because that's that relaxation down and out. Is it, and sometimes it can't because your muscles are like tight. Or overactive. But really the best way is if you can poke on those muscles. And normal muscles should just feel like pressure, right? You push into any muscle on your body, you're like, okay, you're poking on me. Right. If you can push on those muscles and they're tender or they're tight, woo!
So like, push on them up there.
Way. Yes.
Internal.
So usually I have people use opposite thumb and you enter in just a little bit because the first muscle is only about a knuckle and a half deep.
Okay.
And you can push in and then push to the side like you're trying to grab between your forefinger and your thumb. And if that feels super tender, they might be a little bit tight.
This is so intriguing to me.
I know. Usually, so I just use my finger when I work. You don't need anything super fancy. And I often have people use like these test tubes we give out for free because that's the easiest way. I just clean anything you put up there. Please be careful. No one go home and just start sticking things up there. But the best way is to get an eval. But if you want to figure it out, you can also like push up between your sit bones, you know, those bones in your butt. You can like push up into those with your hand pretty good and see those muscles are right there.
So if you feel like pain or discomfort when doing that, that's a good sign that it's like,
and
we're not relaxed.
Kind of overactive. And to be fair, there's no real, like it's a sensitive area. So like some people are like, well, that hurt kind of. And I'm like, well, you also like are jabbing your fingers up there. So like not super comfortable anyway. Right. But I think I truly believe almost everyone should see a pelvic floor therapist. And in France, every single woman receives 10 pelvic floor visits after a baby, free.
What are we doing here?
I'm trying to leave. I'm literally Duolingoing French every single evening. Girl, I'm not kidding. I'm not leaving, but
I did just learn about Duolingo. A student told me about it. I'm like, oh yeah, how have things been going, like wellness coaching wise? And they're like, good. I learned a new language since we last met. I'm like, what? Amazing.
I'm not claiming to learn a whole new language. I'm just like over here like bonjour. Anyway, yeah, I'm like thinking about leaving. Just kidding. But when you talk about like what can you do for yourself, other than an exam, is just taking care of your vulva. I always encourage people to look at it. So I have people postpartum that are like, it looks different. And I'm like, did you look before? And they're like, no, but it looks different. You're like, okay, look at your vulva and then just take care of that skin in not a way that you think, right? For a long time, women have been told they're dirty. That area is gross. It's smelly, right? Like all of these things. It's
Mm-hmm.
actually self-cleaning. It's amazing. If it actually does smell, we might have a problem,
Right.
but it is not stinky. Don't use perfumes. Don't use Summer's Eve soap. Shaving is really not great for it. You can trim. Sometimes toilet papers can be super irritating. Like it's just take care of your queen, right? Like,
Yeah.
but in a
Take
gentle
care of your
way.
queen. Oh my gosh, I love you so much.
I mean, she is such a gift. She is so amazing. And when I do exams, I think there's these questions no one wants to ask me, but I know the answers to already, which is most women don't shave. So stop thinking that you're the only one out there, and don't shave for me. I didn't shave for you. Okay. There's no need. And no, I can't smell it.
That's
Absolutely.
great.
Just like we're good.
You're
You're
probably also
absolutely
like,
good.
especially in today's world, wearing a mask regardless. So
It's amazing. I've smelled nothing. I smelled the garlic I ate today, but like other than that, like I'm trapping myself. But it's yeah, you don't have a weird vulva, you don't have a weird vagina. Like it is perfect just the way it is. And yeah, I just feel like we've been praying for too long on women's insecurities, and it's just the way it's supposed to be, and it's great.
yes, I love that you mentioned that, and it's so cool because for one, going into this interview, I did not expect to talk so much about the vagina, which I'm really excited to because I'm a feminist, so like I'm all
Yeah,
about
go off.
I'm here for it. And ironically, tomorrow, or I guess once this episode comes out, the week after it on Valentine's Day, I'm having
Mhm.
an intimacy coach on, and she's talking about like confidence and sex
Yes.
and everything. So this is gonna pair so perfectly.
Oh my
Um,
gosh.
but yeah, I think it's really great. And again, like one of the big things with GTB is like challenging societal expectations for body size and of what it means to be
Hmm.
healthy and fit. And I feel like just societal expectations in general, even around like beauty and
Hmm.
feminine beauty, what it means to, like shave or not shave, like all of those things. So
Hmm.
I'm just really happy that you're so much more than I anticipated. And it's so amazing, like in the best way possible.
Right? I was like, I
Yeah.
feel like I'm talking a ton, but I
Oh no, I need
just
this.
I have so much to say about women's health. And um although there's so much room for growth in this area,
Mhm.
don't get me wrong, there's still so much we don't know. It is the one area of medicine in which women are ahead of men in, and it just feels good to be a part of.
I love that. I love that. Speaking of women's health
Yes.
and what we had chatted about before we started recording, I want you to dive into
Hmm.
that. Kind of how your job as a PT, how it intertwines and intersects with like weight stigma, weight bias, body size, diet culture,
Yeah.
all of that.
Yeah, I think my biggest awareness in a PT did start when I was in PT school. I was the only plus size person in my class by the end. And I was very aware of it. And I was very aware, like, you get super close with your classmates, and it's like, all right, everyone look at your shoulder, and everyone's just like ripping off their shirts. And I'm surrounded by 6-pack men and cross country women and like me.
Mm,
So I think going through it personally, I know how sensitive it is to go into a physical therapy setting and just not feel like you belong. And most plus size athletes don't seek out care
mm,
because they know they're going to be told to lose weight, and they're self-conscious about the activities they're choosing to do. Right. So you come in with knee pain, and I'm like, oh great, what exercise are they doing? And they're like, well, I'm only walking. And I'm
mm.
like, awesome, you're moving your body and giving it just what it needs. And they're like, okay. And I'm like, no, that's perfect. So how long is your body allowing you to walk? And they're like, about a mile. I was like, amazing, good work every day. And they're like, yeah, like I just
Oh,
get almost maybe too excited.
I just
And
have chills.
so and when I speak with moms, specifically postpartum, my question is always, are you doing any purposeful exercise right now?
Mm,
And they're sometimes they'll say yes, sometimes they'll say no. And I was like, great, because that's in addition to being a mom, which is already exercise, and chasing that little kid around and lifting 20 pounds everywhere you go. And they're like, oh yeah, Yeah. So I think with my experience of PT school, I bring it in an adamant passion of making sure people's bodies feel safe in my space. Because you know how many skinny people I know with pain?
Mm.
That, like, get out of here. It is not because you're plus size. And
Oh.
I oftentimes tell people, I'm like, I'm these are the words I use. Look at me, eye contact. Your body is not the reason you have pain. Your weight is not the reason you have pain. Your tummy, not the reason you have pain.
Mm-hmm.
And they're like, well, I know, but like I said, no, we're going to dive into what's causing your pain, because it's not the fat cells that are causing your pain. Okay. So, we're going to put that on the back burner. Do I know physically that 1 pound off of your tummy is 10 pounds off your knee? Yeah, sure. But I've lost many people without with knee pain. So let's get to the real reason of it. And a lot of pelvic floor symptoms are told it's because you're overweight. So if you have leaking, it's because the abdomen pressure of the weight on your tummy. I'm like, what? And also my knees are strong as heck because I'm carrying around 200 pounds all the time. So freaking back off.
Wow.
Yeah, I am, and additionally, like, to all of that, I do see all genders, right? So pelvic floor, I assist with gender affirming surgeries, genital gender affirming surgeries. So we get penis to vagina. We do the vaginoplasties at my work at the U. So all bodies look so different, but we get to celebrate them in my space. In my room is a personal treatment room. So you're not out in a gym. You're not being judged by those around you. Physical therapy isn't for the athlete running marathons. It's for the mom chasing 3 kids. It's for the person that's walking 1 block a day because they need to move their bodies, right? Wow. It's the person that is doing bed exercises, right? It is for every single person. And I think my biggest recommendation to anyone is don't let your pelvic symptoms take a back seat, and don't let them persist for too long. It's harder to treat pain if it's been around for 8 years. If it starts now, get help now.
Right. You know? I have to acknowledge how I got the chills like 3 times, and I almost started crying when you were talking, because it is, I just have to acknowledge how good that feels. I can imagine coming from a doctor to say that, your knee pain or your, incontinence is not because of your weight. Like, oh, I've learned so much as somebody who has thin privilege and lives in a, more societally accepted body size. I feel like I've learned so much about weight bias and weight stigma in healthcare. And since I've started this podcast and just taken a deep dive into intuitive eating and everything, and the amount of conditions and that get misdiagnosed and ignored, it's absolutely disgusting. And so I just want to acknowledge and thank you. I want to say thank you, and I want to hug you through Zoom so much. I just want to kiss your pretty little face all over, because what you're doing and like the messaging that you're using, it's so impactful. And so thank you so much.
There's some really cool research that came out somewhat recently that was talking about actually how in this younger generation, Gen Z, going off, doing great things, that racial bias is going down. Like, it is trending down. Good Lord, I hope it stays that way, right? But body fat phobia is on the rise.
Yes.
And so body stigmas are so on the rise. And in our charting, in our notes from patients, there's a part in the initial eval where you put like contributing factors, like what is making this harder on them. And so for pelvic floor symptoms, I might be like postpartum status, or low back pain because it's all connected, or post hysterectomy, like things that are going to affect this area without it being the reason necessarily. And the amount of PTs that put weight or obesity in there blows my mind.
Yeah.
And I'll read other notes. It's their hip pain. Well, a contributing factor is probably their weight. And I'm like, there's so much else going on in people's lives there's no way that is all you could come up with right now.
Yeah, and
Come
it's
on.
like even if we truly believe that that is a contributing factor,
Yeah.
like it can't be the only one. And
No, it isn't.
yeah, it can't be the only one. And I feel like
Mm.
so often it's used as a cop out in so many different situations. Like
Yes.
I've heard it even with like personal trainers, with health coaches. I mean, it's all over the place. Like
Mm-hmm.
it's just so easy to say, "Oh yeah, if you lose weight," right? Because it just ties in with the messaging that our society has for everything. And
Well, and I've never entered a space not knowing I'm plus size.
mhm,
Fully freaking aware.
mhm.
Too aware at times in my life,
I
right?
bet, yeah.
I am a plus size person. So you like when I go to the doctor's office and they bring up my weight, girl, I know. Come on now.
Right.
And I think every time I go to them, I'm like, okay, what's my like not lie, but like what's my plan to lose weight? Like what am I
Wow.
gonna tell them? Um
Wow.
yeah, I'm working out, but like yeah, I'm just gonna add more like
Mm.
weightlifting soon. And oh yeah, I just started eating cauliflower for breakfast. I don't know, like
Oh God.
you come up with these things because you want them to like not give you a lecture.
Mm.
Like, oh, I'm taking care of it. Like, don't worry.
Mm.
Because I don't want to sit through 20 more minutes of another lecture I've heard 18 million times of, well, if I do this, it's better for your health and whatever.
Yeah, it's ridiculous. And I don't know if it's the same research that you were referring to earlier, but I know like in intuitive eating, we talk about how like weight bias is as it's like proportional to racial bias at this point too, like
Mm-hmm.
how often it occurs. And that, I mean, there's also studies that show worrying about our weight negatively impacts our health more than diet and
The
exercise
weight
improve our
itself.
health. Yes,
Right.
yes, yeah. It's just like there are so many things we could go on and on. Literally, this is why I started a podcast because I was like,
I
I have
know.
a lot of shit to say
I have
about this.
hours of shit to say.
Yeah.
Well, and I do think though physical therapy it needs to do better because we're the exercise prescription,
Hmm.
right? Because your weight um isn't on display in an endocrinologist and a
Mm.
dermatologist. When you're in a PT gym having to do exercises in front of people, your weight is on full display. Your uncoordination is on full display, right?
Hmm.
All of your fears and insecurities. And so I think PTs need to do a better job. And I've heard not from my coworkers, we do a lot of good training, but I have heard PTs in the past say things about weight and bodies and just grinds my gears if I were to
Hmm.
say it in the most
Nice way.
PC way.
Yeah. Yeah. I'm curious, is there like a way that, because I don't know if you're familiar with Health at Every Size, but I
Mm-hmm.
know that there's like the Health at Every Size directory where folks can go on to find a physician, like a primary care doctor that's Hazel aligned. Do you know, is there like a place that for physical therapists where people can look into that? Or
I
there's
don't,
not enough
and
of you.
yeah, I feel like I could just bet money that they're not there, or they
Yeah.
just don't have the same passion as I do for
Yeah.
it. I mean, I think there's plenty of PTs out there that would be accepting, are accommodating,
Hmm.
are empowering. Um, I just think they're scared because because a little bit of scope of practice too, right?
Sure.
They don't want to bridge into diet. They don't want to bridge into supplements or medication or anything like that. And so I think a lot of people get scared and they don't want to offend. And so
Hmm.
um, I think as a plus size lady, I do get away with it a little bit where I'm like, hey, look at my tummy. Anyway, let's talk about our tummies together.
Mm.
So I think I get a little bit of a
Mm.
little bit of a connection.
Hmm. Yeah. Yeah. I feel too that because at least I can speak from my own experience because it kind of goes against what we learn, like traditional,
Mm-hmm.
conventional, medicine teaches and around BMI and obesity and all this, that it's also probably very nerve-wracking and scary to go against the grain and, so,
Yeah. Oh, it is.
but you gotta do it for the health
I'm
and
getting
well-being of people.
I'm getting
You know?
fit from fighting the patriarchy.
Yes. Yes, I love it. Oh, Mary, what else? What else do we need to know about pelvic floor? Um, I know that I had written on here like misconceptions that you see
Yeah,
online. I know that I feel like we've talked a little bit about those, like the
throughout. Yeah.
Kardashian Kegels and the, stopping your stream and everything. But what else? Anything else that you think would be helpful for folks to know?
Right. Um I'm trying to think. A lot of postpartum stuff is where I also have had specialty in, and
Hmm.
like ab separation or diastasis rectus abdominis, pardon,
Yes.
is massively common. And so I deal with that both during pregnancy and postpartum. And I think it's also another one of those areas in which women just go, well, I'm pregnant, so or I'm postpartum, so it's fine. And that's just how my body is. And I'm pregnant, so I'm gonna be in pain. I'm like, where were you? Like, I get people a lot postpartum, and I'm like, you had debilitating pain every 3 days, or like, where? Come in, see me. And then I also do clogged ducts. So if you have
Oh.
like clogged ducts while breastfeeding, I can manage those. Not every pelvic floor therapist does that, I guess, specifically, but there's just, when I talk about being like women's health physical therapist, which is, we've gone away from that into pelvic floor, but women's health physical therapist, we really do mean like boob things and
Hmm.
tummy things and butt things. So I think if I could encourage anyone, it would just be like, if you're pregnant or postpartum, come in. And a huge one during pregnancy is everyone comes in, they're like, well, I just want a strong pelvic floor.
Mm-hmm.
And I'm like, that's not super helpful during birth, because
Mm-hmm.
all of those muscles actually have to stretch and get out of the way for baby to come through. So strength of those muscles don't mean much. Coordination does. Can we relax them? Can we relax them? Can we chill out? Can we push them out? So we will do sometimes some like push training, which is helpful in the moment. I always talk about like sports comparison, right? You like shoot free throws, so when it comes game time, you're like, you can nail it because it's just muscle memory. I can't reproduce uterine contractions in the clinic, which is probably a good thing.
Yeah.
So can I guarantee that your muscles will relax while you're going through like this bonkers pain? No. But also, if we get used to that relaxation, it will be easier in the moment. And if there is weakness, great, we can work on it. But that's not really, a strong pelvic floor is what a lot of people come in asking for. And it's not exactly what you should be asking for. It's
Mm-hmm.
just like, what is my pelvic coordination? And just taking care of pain while when you're pregnant, I guess. You know,
That is interesting because I have always been like, oh yeah, even like my
strong.
question to you was like, how do you strengthen it? Like,
Yeah.
like then now I know that that's not the most important thing that,
Mm-mm. And
for
like,
it.
to be fair, people come in and they're like, I pee my pants and I can't control like my gas. And I'm like, cool, this one's probably gonna be weakness. And I check and I'm like, yeah, you just can't activate them. Great.
Mm-hmm.
And then we work on strength. And not just pelvic floor strength, but we've talked how everything is related. Recent research came out 3 months ago now that glute strength is a huge contributor to urinary incontinence. So we work on butt strengthening.
Mm-hmm.
Your abdomen should be strong to help support that pelvic floor. So I always do core strengthening. And it's not the typical core strengthening that you think of. It's not necessarily planks and sit-ups and V-ups and all those other things. There's a muscle that sits deep to all of those muscles, right? Everyone knows there's six packs, obliques. Your transverse abdominis sits deep to all of that. And if you look anything up about postpartum, you've heard the word transverse abdominis. And I usually compare it to like the kid in the group project that doesn't do anything but gets the A, right? Because his name is Brad in my head. Brad, things become
Yes.
too hard. Brad checks out, right? And so a lot of my core exercises have to be simple, low level, so Brad can participate.
So
And
nice.
right, so glad he joined us. So my exercises, you don't walk away from my core necessarily being like, oh,
Right.
worked it, I am ripped now. It's more about stability, bringing things in. It's just a common misconception about, I really want to be as strong as possible flexible and I need to be fit and defined. And really it's coordination. It is, can these muscles turn on? Are you stabilizing well? Which in the long run takes pressure off your back, takes pressure off your pelvic floor. It's just, we tend to overdo, right?
Yeah.
We tend to overkill those exercises.
Yes. So, those are good misconceptions that you noted. So the things I'm thinking of, like takeaways or like things that folks can do at home for pelvic floor care. You mentioned like if they want to try out their own internal exam.
Well, first look at it.
Look at your vulva.
Check out your vulva, ladies. What is she up to? What is she looking like? Yeah. Two, if you want to like poke around, absolutely. Whether that be with your finger, whether that be with toys, you just insert it not very far and you can tilt to the sides and you can feel those muscles. Normal just feels like a deep pressure. So, like when I always tell people, physicians learn on patients, PTs learn on each other. So I've had this done to myself. And so I know what it feels like. And when my muscles are fine, I'm like, it's just a weird deep pressure in there. Right. So if that's the case, man, you're doing awesome. And then you can even do a Kegel and try to feel it.
While it's up there.
Yes.
Okay.
And then you can feel that contraction.
This is so interesting.
I give grades or strength ratings on how well someone can squeeze. And so, what I look for is, can it constrict and can it pull up into your body? Those are the two things I look for. So if you are feeling no movement at all, call your local pelvic floor physical therapist. So you can see what's going on. You can see if it's, relaxed or not, or overactive, sensitive, tender. And then just don't forget it's a part of a whole body system. Whether that means strengthening glutes or core, or whether that means stretching your legs, your butt, your inner thighs, your adductors, getting things to calm down from a global perspective. It sits in a whole system. You're one person.
Wow. I am like mind blown. I really am. In the best way possible. I don't know if you can see like my wheels turning, but this is just, I feel like I've learned so much. I really do.
I do. And I want to fight the good fight. I do. I want to get out there and speak to eventually like post-COVID things. I want to get talking to moms group. I want to talk to nurses and teachers. If you're a nurse or a teacher listening, make an appointment, because none of you pee enough, because you hold it for 8 hours and then you have problems. So come see me. I just like, there's groups I want to educate. I want to do stuff with. This podcast is perfect. I just, but I'm also like booked like crazy, because if you're experiencing these symptoms, you're not alone. There was a time earlier this couple months ago, I was booked for 6 weeks at a time.
Oh, wow.
Right. So, that's not super normal. Now it's down to, I think, less than a month. But I just, we are busy because no one's doing well. Yes. And we're super, super busy, and you're not the only one experiencing this. So get ready to chat about some weird things.
Yay. You're amazing. You seriously are so freaking cool, Mary.
Hush. You are cool. The fact that I was like, you reached out to me and I was like, this is the dopest podcast I've ever heard of.
Oh my gosh.
I'm like, I'm here. I'm for it.
It's just because the name's fun. It's not like all the other like weight neutral, non-diet ones where it's like food freedom, like feel your body. It's like, give them the fucking bird. Like, everyone's like, what's the name of your podcast? I'm like, give them the bird. Yeah. And like, it's up to play on words in multiple ways. Like, just, you have to listen to understand. Otherwise it's just gonna,
no, it's everything. It's everything that I do. It's like, for too long, women have accepted it, and I'm like fighting for us. And then I'm like, but also for too long, we've said weight is the issue, and I'm like fighting that from the inside out. And for too long, like, it's like all of these things, and those big societal issues. For too long, the church has controlled like how we participate in sexual activity, and I'm like trying to fight these systemic issues from the inside out. And so it's amazing to listen to your podcast and hear about those other like female fighters that are just trying to make a better world for ourselves.
Yes.
For too long, we've accepted it.
I know. I've been thinking about like, I need to have more men on my podcast, but then I'm like, Sometimes. I've had a couple.
And if your man experiences erectile dysfunction, I can also help with that.
Oh, wow. Yes, this is for everyone, and I want everyone to feel welcome in the GTB space. And I just really like women.
Yeah, me too.
Yep, I just think that
I'm learning to love the male population. I treat testicular pain almost every day, erectile dysfunction, male incontinence, and my dad had prostate cancer, so which is huge in men. So I deal with a ton of stuff. And then, as I said, all genders are in our clinic, and I specifically specialize in the LGBTQ community. Nice. So you're right. Yeah, everyone's welcome to my clinic. I love it.
Yes, I think that you are so empowering. I seriously feel so empowered. I feel just like, I'm gonna have to take a screenshot or a video of you doing this and post it all over.
Air pumping the whole time. Yes. And I think my number one referral source is like wine nights. So this is perfect. This is the time where I'm like, oh, well, yeah, you actually treated my cousin, and she told me. So like GTB like is exactly where I should be, because I'm like reaching these women that are all going to go out and tell the girlfriends that you don't have to pee your pants anymore.
Yeah. And there's a lot of local, like to Iowa City, Coralville area that listen to the podcast too. So this is amazing. So you are at UIHC, you're at University of Iowa. And
I'm at the main all of us are at the main hospital right now.
Okay.
Main campus.
I might just like link to your profile in the show notes.
Oh yeah. I got my professional photo there. Perfect.
Yeah, people are going to be like, this isn't Mary. No.
Yeah, she looks like she has herself together.
I'm just kidding. You're amazing. And so TikTok. Oh. You're going to get it going. And maybe by the time this episode comes out, we can link it in the show notes too. That'd be so great.
I know. I just, like, a patient the other day, as we're leaving, was like, this has been so fun. I've learned so much. You should start a TikTok. Great. This lady's like 58, I think. I was like, TikTok, like, go off.
Funny.
The problem is I am so close to creating a TikTok. It's not even funny that it's going to take a little breeze for me to sign up and create.
This is it.
Are you my gentle breeze?
Yeah. I'm blowing on
Are you my
right
derecho pushing me off the edge?
Yes. Yeah, I really think you should, because you have described the pelvic floor and just talked about it in a way that is so relatable. It's so easy to understand. And your personality, like, I know a good personality when I see one, let me tell you. And you need to be on the interwebs. Seriously. I really think that you should, and I will I'll even get a TikTok just so I can share your shit.
Okay, well, be careful about downloading TikTok. You'll lose so many hours of your life. But
yeah, I'm nervous about it, and I'm probably gonna like scratch both my eyeballs out if I scroll through it long enough and see all the harmful shit on it.
True. True. Okay. It will eventually algorithm itself to you, and you'll see the stuff that you want to see. Like, I'm on intuitive eating TikTok. Come on now.
Oh, hell yeah.
Yeah.
Love intuitive eating. Here for that.
Yes.
Well, this has been seriously amazing. I can't say that enough. I guarantee that I'm probably going to want to have you on for a future season, because that would just be amazing. Thanks for tuning in to another episode of GTB. If you're enjoying this podcast, feel free to head on over to Apple Podcasts and rate, review, and subscribe. You can also share this podcast on Instagram and tag me at Give 'Em the Bird Podcast. I will see you back here next week for another episode, but in the meantime, go give 'em the bird.